So today I'm going to talk about the role of ethics as such in healthcare communication. So I would be running the presentation, which is of 25 slides. Let me candidly confess in the beginning, the slides are a little bit of heavy. When I say heavy, the content is a little bit on the jargon terms. So I would try my best to jump down to the common understanding and explain it to you what exactly I mean and what message I want to convey on each slide. End of the whole presentation or the session today, I would be very happy if you understand the whole messaging which is on my second slide. So this is what I'm going to be covering today. What is health communication? Which are the various stakeholders involved in the healthcare communication or health communication? What is the scope of health communication as such for all the stakeholders? Why do we need the ethics in healthcare communication? What is the impact on business as such or on the stakeholders in layman terms when you talk about any unethical practices for healthcare communication? What are the ethical concerns on the larger front, and what are the best practices to be followed when you're doing any kind of healthcare communication, and what is the take-home message? Okay, and briefly talk about the career opportunities when you talk as such in healthcare communication. That also I tried to cover up in my last few slides. Now, what is the health communication? The health communication should adhere to the principles of beneficence, non-maleficence, respect of personal autonomy and justice. What do you mean by this is that in a layman term, it's the exchange between the healthcare professionals and the patients. Now, there are different stakeholders jumping into it when a doctor talks to patient and a patient talks to doctor. Now, we'll see the stakeholders. Now, whenever such communication or exchange of thoughts or ideas are happening, what is to be followed and what is not to be followed. So my first bullet in this slide talks about the principles of beneficence, means one who's supposed to be benefited with honesty has to be benefited completely. Non-maleficence means there should not be any fraud involved in that communication. Respect of personal autonomy. A decision-making power should be equal to both the parties which are involved, be it patient or be it doctor. And there should be complete justice given to the stakeholders involved, not compromising their education, experience, financial status as such. So let's go ahead and discuss this in detail. Now, before we jump on the stakeholders, what is, in a layman term, what do you mean by effective health communication? We spoke about two parties here, patients and doctors. Now, what is expected? It should eventually, a good communication or an effective communication means it should enhance the patient's experience, that he should feel happy. There should be some kind of improvement in his understanding. It should be part of treatment or the patient care on a larger front. It should reduce his complaints. It should increase nurses' self-confidence when they're talking. A doctor might pass on a message to a nurse, some educational platform might pass on a message to a nurse, and then she will pass on the correct message to her patients, which she's dealing with or handling. Then it might open up the career prospects for the stakeholders involved when the right, correct, honest, and non-malified information is being passed on. Job satisfaction to all the stakeholders involved, that they should feel happy that it's a non-corrupt, transparent communication happening for the role they are involved into, and it should reduce the stress whenever there is non-transparency, non-autonomy, incoherent, corrupt information being passed on. The parties which have got insight intact, they might feel stressed, or they've been compelled under the obligations from superiority or the political atmosphere present in the scenario, might induce stress in the stakeholder or the counterpart involved in passing on the unethical communication as such. So effective communication, eventually, what should we achieve? It should enhance the patient experience, overall experience. It should reduce the complaint confidence of the stakeholder. Just one example mentioned is when you talk about nurses, the confidence should go up. Professional standing has to be respected. career prospects have to be increased, job satisfaction for each stakeholder who's involved, and it should overall reduce the stress of the counterparts involved. Now, who are the stakeholders as such? This is the bird's eye view. There could be many more stakeholders as such involved into it. One is the HCPs and healthcare providers, the key part who's delivering the message. The patients and his relevant, the ones who are receiving the message on most of the occasions. Paramedical staff, it could be nurses, it could be housekeeping boys, it could be attendants who are present there. Then the technicians who are directly dealing with patients, like machine operators, device operators and all. Pharmaceutical companies which are passing on the products, devices or nutraceutical products to patients or the end users. Government agencies which make laws, which make policies, which governs the whole system, and NGOs and caregivers. In the recent times, we also have various non-government organizations which play a bigger and larger role for safety and well-being of patient. When the systems are dominant, the healthcare provider could be dominant, or he could be financially and position-wise very strong. If somebody has to take action against medical legal issues, the government agencies can be bribed or can be pressurized. In such cases, a common man doesn't have a standing. Now, though the laws might be there, they can be twisted, folded, and used against the common man. In such case, a larger force in the form of non-government organizations, patient care organizations, they also come into picture, and they play a very good role in healthcare communication. Now, what is the scope now of healthcare communication? Health communication intervenes invariably, raises ethical issues because they aim to influence people's views and lifestyles. Now, when I say about views and lifestyle, these are the communications which are on the non-clinical practice platform. Whatever information you receive, like the routine practices of your daily health, which may not need you to visit a doctor. Say, for example, I was today discussing with my team one of the ads which you used to see, that Asian Paints is approved by I-CME as an antibacterial paint. Now, God knows how it is related to it, for which the I-CME Delhi office were taken to task, and there are a lot of issues which have happened. So I mean to say that health communication invariably influences people's views and lifestyle. Not everybody would believe, but there will be a certain strata of population which will start believing something which is coming in front of them without thinking whether there is an ethics, there is a science behind it, or they just blindly follow. Anybody which celebrities endorse, be it a cold drink, a cigarette pack, a food, a cycle, or a paint, or whatever comes to you, they will say, no, Shah Rukh Khan and Salman are promoting it, it has to be good. But then the ethics part of it has to be validated, viewed, and reconfirmed by the stakeholders which have the responsibility of saying it's right, it's wrong. They are often initiated, funded, influenced by government agencies or powerful public and private organizations. This is what I wanted to say. Now, all such discussions or healthcare communications on the larger platforms are initiated, funded, and influenced by government agencies. Now, when I say government agencies, information which you receive with regards to COVID in recent times, like the government databases by the central government, by the state government, by the municipal corporations, these are the government agencies or their health authorities which are passing on regular updates, what you receive on WhatsApp, in your friends group, in your society groups, or any other platform, on LinkedIn, Instagram, Twitter. There's a difference where there are handles of these agencies where they pass on the information. So this has been initiated, funded, and influenced by agencies when a government agency has to jump in. But when it's a profit-making kind of an communication which has to be passed on, it can then come to any public-private partnership or private entities which have got some financial interest out of it. With the increasing use of commercial advertising tactics in health communication intervention, the ethical issues regarding advertising can be raised in health promotion and communication when it applies techniques such as highly emotional appeals, like when it comes to mother and son, when it comes to kids looking after their parents, like the routine ads in Diwali, or during Eid and another festival, talking about go and run your to natives and meet your parents. If these such emotionally driven ads dealing with healthcare messaging, now these are the different techniques which influence your decision making process when it deals with your purchasing mm, attitudes or your decision making attitudes with regards to your health as such. It could be service or a product. Then the highly emotional appeals, exaggeration of the information being passed out, omission of some important information on safety parameters or some hidden facts can lead to incomplete information and hazards in future. Provocative tactics, that you give a provocative information to certain religious groups, certain communities, or um, uh, any kind of provocative information which under the label of healthcare information passed on, and the use of children's, again it's an emotional angle. So these are the tactics that are normally being followed. So when we talk about scope access, what is being passed on, for what purpose it is being passed on, who's being utilized in which manner, and how is the platform being used to pass on the information. Now, in all this information sharing in healthcare, why do you need ethics? Okay, we spoke about which are the stakeholders, what is the healthcare information, how is it being passed on. Now, let us see, why do you need ethics in any kind of communication which is happening amongst all these stakeholders? Now, key ethical concerns relates to infringing on what might go wrong if something unethical is passed on, or what way it will affect and what will it affect. A person's privacy might be encroached when the ethics is compromised. It might interfere with their right of freedom and choice. Something is hidden, something is not being told, exaggerated information, emotional appeals are being given. Autonomy, the decision making power is compromised for that person. If I'm emotionally debilitated, I'm passing through difficult times and I have to take a healthcare decision, might not be practical at that point in time to take the decision. I might take emotionally biased decisions. Issues of equity like gender, race, religion, irrespective of that, the decision making power in the form of information is being shared has to be offered to the end user. Interventions using digital media raise ethical issues regarding the digital divide and privacy. We all know we use so many mediums like WhatsApp, Instagram, Twitter, LinkedIn, Facebook. Now, what is with us and what is being shared with the whole world? In last few years, you might have seen a lot of issues happening with Facebook, a lot of issues happening with the other portals, that how biased they are, what is the privacy level we have, and how we should take care of our social hygiene at a regular interval to ensure that whatever is private should remain private and our personal life should not become public in all such cases. And exactly the same point is very important when you talk about healthcare information sharing. The intervention may have unintended adverse effect on psychological well-being of individuals or a group of individuals. Now, why do we need ethics? If an unethical health information is being passed on, it might compromise a person's psychological well-being. Patient might get depressed, patient might get anxiety or bipolar disorders, he might land into with a chronic. Suppose you tell a person go, and if he has got some complaints and initial findings, and a doctor goes and tells him that you probably have a chance of having a cancer, and a young guy getting a wrong information, he might go into depression or might get a heart attack. So that is the impact of passing on the incorrect information. If suppose you pass on such information in a group, suppose the same information goes, a doctor calls the whole family, oh, it's a big news, I need to share. There's a small error in diagnosis, or the reconfirmation has not happened. I'm just giving a hypothetical example. So that is what I mean to say. What could go wrong psychologically and eventually, physically, when an incorrect or unethical information is being passed? They can also have an impact on cultural aspects of the society. For example, idealizing a particular lifestyle, turning health into a value, and raise concerns regarding democratic process and citizens' consent to the intervention. So when big agencies like McKinsey and other PwC and all, who are the ad agencies dealing with all other information, but even when they deal with healthcare information passing on a larger front, single patient to doctor information sharing, this may not be such a great criteria or an issue. But when it's a community or a mass communication on health happening, you have to take care and be very careful about the lifestyle of a community or the value system or the democratic processes which a certain group or a citizens group is following. There are also ethical concerns regarding collaborations between health promoters and for-profit organizations like pharma companies or device companies or the nutraceutical companies. At times, I don't know the percentage because I'm on this side and I know how it goes, but still that, yes, for sure, there happens influencing by the such organizations when it comes to healthcare promoters. Promoters would be associations which are for the physicians like I-CME or Orthopedic Association or a pediatric association or a leading KOL coming out in the market and saying that use this is really great. He will not do it for a free of cost. 99% there's monetary gains involved. But not everyone is like that. So maybe 1-2% or even 5% would say, no, don't believe in this, I don't take this, I don't want to do this. But yes, a larger chunk would have a relationship that a healthcare promoter or a thought leader or a key opinion leader might join hands with for-profit organizations from the industry and might pass on the unethical information to the end users. Identifying and considering ethical issues in the intervention is important for both moral and practical reason. Now, moral and practical reason, practical is for sure, it will have hazards involved, which I will cover in my sign. Moral is all about your upbringing and culture, be it patient, be it for-profit organizations, leaders, be it government agencies, or be it the eventually doctors. That what is the moral value system in them, the way they have been groomed, where they keep value system high when it is compared with the monetary gains or some power gains or authority as such, when they have to deal with the critical healthcare information passing. Now, on this slide, what do you mean as such by ethics for healthcare professionals or HCPs? Now, all the ethicists or so-called papers or leaders, they have presented a series of moral obligations for healthcare practitioners. Now, what it could be, it doesn't limit to these 6. It could be more than this, but eventually it's how you have been groomed to do the utmost to better people's health. The doctor has to always think about how can he better the patient's health to avoid doing them any harm. Do not intentionally do any harm when you pass on any information to the patient or patient's relative, whether on a physiological, psychological, social, or cultural platforms. To respect autonomy and privacy. Do not infringe the person's privacy. Do not infringe the autonomy of a patient or patient's relatives. To ensure equity and fairness. Don't be biased that, he's from low socioeconomic condition. No, he's cash rich. Let me handle him this way. Treat all patients equally. Again, no religion bias, caste bias, financial status bias. These all should be ruled out when a doctor and patient relation is happening. To provide for those who are particularly vulnerable and who have special needs. So whenever there is a special population, he has to step up one level up and ensure that the right differentiated information is being passed on to such special population and their caregivers. To maximize the greatest utility from the health promotion efforts, and especially when resources are limited. In the limited time, in the limited resources, in the limited systems or infrastructures available, you have to ensure that you are not compromising on the information which is being shared. You have to ensure that critical information as it is to the best interest of the patient is being passed on. Now, standard stipulation for health communication. Now, what is on a generic level, what should be passed on, how it is to be delivered? The obligation is to be truthful and not base claims on hidden arguments. Have the facts in hand when you're passing on the information. Pass on the exact truthful information to the end user, be it doctor, be it pharma company, be it government, be it any NGO, to the end user. Acknowledging alternative ways of framing and prioritizing the health issues. You cannot be just saying that, no, I would only pass on, let the patient come and meet me in my clinic. If the patient is far off, have WhatsApp, have phone call, have emailing methods. So any other information which would serve platform, which would serve the purpose, has to be used in passing on the information. Ensure that issues are truly relevant to the intended population and not made to seem relevant. What does this mean? That pass on what is only required. Do not give jargons or extra information or irrelevant information to the party where you are passing it on, because it will only confuse the end user and might not serve the purpose. Offering accurate, complete, relevant information on the health issues. Providing reliable, correct, and accurate claims. What do you mean by claims? Whatever information to whichever stakeholder in this chain of healthcare communication you are passing on, it has to be scientifically backed up. If it is a scientific information related to it, it cannot be fictitious, it cannot be unreliable, it cannot be incorrect. So whichever party which is passing on, be it doctor, be it the be it the pharmaceutical organization, be it government agency, or be it any non-government organization, whenever they are passing on any information, it has to be fact-based. It cannot be something in the air and just been dropped into the hands of the patients. Again, a continuation of last side, not exaggerating negative consequences or the magnitude of problem, even if this would positively influence the intended population. Do not tell the patient, no, you're going to die in 2 years, you're going to die in 3 or 6 months, and all. He knows, you know. Once you announce something, they know. Only pass on the practical information. Do not exaggerate unnecessarily negative consequences to patient or patient's relative. You might confide to one of the person to make them prepare. But on a larger scale, what is meant by this bullet is that pass on the exact information. Do not exaggerate even positive points. Do not exaggerate the negative points also. Be optimized, be correct and reliable when you pass on such information. Unduly influencing patient or patient relatives or any stakeholder would only harm the other stakeholders in the whole cycle. Not modeling inappropriate behavior. There is a way of passing on information. Being dramatic, being fictitious when you deliver information, not acceptable. Not offending cultural norms and belief, yes, for sure. Providing fairness and balance, accuracy, being fair and not being biased. Not stigmatizing certain behaviors or groups. Do not target a group or a community or a person in such a way. Avoiding stereotypes, even if doing so seems to serve the goals of intervention. Do not be stereotypic. This information has to be passed on in this fashion because it has been done for so many years. If there is a special population, if there is a special patient, you can always change the approach, which is win-win situation for the patient and for yourself. So that's like avoid stereotypes when needed. Now, just one slide that what could be the barriers in communication. I just put in for nurses messages and how patients might confuse them. Now, a couple of them I will read for you. Barriers to the effective communication. What would be the nurse's intended message and what would be the message received by patient in different from the intended message? So the red box which I'm reading, patient decodes messages, interprets it according to own values, beliefs and experience. And what are the factors which are contributing to such poor communication? Patient believes that previous experience, oh no, it has happened that if a nurse has told me like this, it could be this. Personal attitudes cause patients to reframe messages to fit their beliefs. No, I would only understand in this fashion. Now, what goes wrong here is that whenever, suppose if it's a nurse involved in passing on information, the party which is passing the information has to ensure and reconfirm the correct message. Just delivering this message and leaving the place would not serve the intended purpose of that whole communication process. Patient in pain, distress, tired, and on medication that affects their understanding and cannot absorb messages. Now, what is responsible here? Why is it happening? Because the patient's condition. Message is not absorbed due to patient's condition. For example, effects of medication, dementia, hearing problems. This is what you want to tell. He will not understand. You have to pick up a person who will, you will take the message correctly from you, being in the patient's relative, or find out a time when patient is in a proper condition and then deliver a message. Patient cannot hear a message properly due to the background noise or hearing impairment. Nurse's message is ambiguous, patient misunderstand. Complex messages, jargons used, patient nurses from a well-to-do socioeconomic condition, and she has a patient from slums, and then she uses high-end slangs and all, and patient is absolutely unable to cope up with the message, and it gets bounced. So these are different situations of hindrances of passing on the messages. Now, what might go wrong if such incorrect or unethical information is being passed on to the end user? It is estimated that the cost of, this is for UK, I'm just sharing so that you could understand similar things happening in India. We don't hardly do any such studies in India, but I did not search it. I just wanted to go with the developed world where the systems are more established and we could actually refer to such a data to know what happens. So NHS is over 1 billion per year because of, now it is not the estimate, because of the incorrect information, what is going wrong, which eventually results in loss of, loss of money by various means. It can lead, as per the 2016 published data, not the latest one, but my intent here was to pass on that yes, wrong communication can lead to loss of money and business impacts are huge. Now, poor adherence to medications regime, non-compliant patients on OPD basis, not continuing treatments for longer durations, and then not understanding what might go wrong if they are not compliant or non-adherent to the medication regime. Repeat visits to clinic, you said not to come, or you said come on this day and patients are not coming. It might affect, it might prolong the illness, it might add on to their expenses, travel times, stress to the patient and their relative. Disputes between the staff, the HCPs and the patients might happen if there's a miscommunication happening, and untimely litigation. That, these all issues in last 10-15 years where you see patient and their relatives coming and beating up doctors and, damaging the hospital properties. It is also part of incorrect healthcare communication. Not always, but nowadays, if you see doctors informed and doctor reconfirm they are understood the status of the patient to the relatives, to the patient, they take in writing that if something goes wrong, the patients will be completely responsible for the damage to be recovered. And there are government laws now which cover the doctors, and in the colleges and hospitals, if somebody come and beat, there is a fine or imprisonment up to 3 years for the relative and the or even the patient who is beating the doctors. Now, one more point I wanted to share. What are the patient perceptions on the ethics? Now, if I'm a patient and I wanted to hear something from doctor, technician, or the paramedical or medical staff, what are the 10 things which are in the order of preference as perceived by the patients? Now, this is very important. From a layman's perspective, there's a survey by which the data has been published. Everybody wants to know what are my rights. If there's a surgery happening, if there's a prolonged illness happening, if you have to admit someone or you want to get admitted, you want to know what are my rights in this. Equity of resources. Who's treating? How is it treating? What is his education? Am I getting fair treatment in all this? Confidentiality of the patients. Is my confidentiality kept intact? Patient safety. Am I going to be safe? For sure, I'm going to be treatment and all is happening, but I hope I'll get well through this. What are the follow-ups? What are the post-op procedures and all? Conflict of interest. Now, not always, but sometimes when some patients are part of studies and also, Indian healthcare is not that groomed or matured to, on the patient side, on the hospital side, that everybody could be mature enough to understand. But yes, there are conflict of interests, ethics of privatization. Now, the ethics system followed in the public healthcare system and ethics system followed in the private healthcare system could be marginally different. But yes, they would follow only law. In the public healthcare, it's always the mass treatment, mass communication happening. There's a thin line. Informed consent on the all critical procedures, expenses, like when you admit someone, when you go for surgeries, when you go for long duration treatments and all. Are you being properly informed? Is it getting documented? Have you understood the detailing of that thing, that whole process? That's the job of the person who is informing you. Again, that you cannot shrug off your shoulders and say, no, doctor ne bataya nahi, he didn't tell us. It's your responsibility also to get the details correctly until you're fully satisfied. Dealing with the opposite sex. Now, it's like in communication parties, if it's a lady doctor, if it's a gent doctor dealing with opposite sex, and then there are issues which have happened recently. So that has to be critically handled. Like, females prefer to go to a female gynecologist. They don't want to go to. So such issues do pop up in healthcare communication, more comfortable with that. Beginning or end of the life, yes. When a childbirth or death life situation is happening, and healthcare team ethics, whosoever is involved, you do go there. Is the hospital, is the team there ethical enough? Now, these are the top 10 concerns which a patient or relative might have whenever they are dealing in any kind of healthcare communication with hospitals or doctors. Now, what are the key ethical concerns? Now, quickly, I'll run through this slide. Most of the things I have covered, but I just thought maybe I'll just touch up. Key ethical concerns in health promotions, like you might hear, or you might go to doctor's clinic, or whichever way, where you're dealing, reading, or being conveyed about any healthcare information, includes issues related to infringement of persons or people's privacy. You have to ensure that this is one of the biggest criteria. Interfering with the right to freedom of choice. Now, while taking a critical decision on admissions and operations or any other procedures related to healthcare, whether you have got a full freedom in taking a decision or it has been compromised. So it's the biggest ethical autonomy for the sake of promoting the health of individuals or society as a whole, whether you had all the power to take the decision along with the right to freedom. Ethical issues in health promotion interventions raise concerns regarding unequal or unfair treatment or provision of services referred to as equity, disruptive justice, which expands the term to include unequal distribution of risk and burdens. If it's a doctor-patient which is communicating, the risk and benefits should be equally distributed. Not all the risk should go to patient and all benefits going to doctors. So the communication has to be equally justified when it comes to such communication happening. Now, what is a checklist? This is for not healthcare. It's an overall effective communication checklist, but applies to healthcare also. Use this checklist to identify areas of improvement. Do you use appropriate language for your audience? Do you listen actively and concentrate on what's being said? It's not only for doctors, it's for patients also. I mean, the stakeholders, both parties which are involved. Ask open questions to gain information. Do you demonstrate your listening? Do you use appropriate body language? You reciprocated, yes, I heard and I understood. Do you respond appropriately to other people's body language? Do you check you have understood and have been understood? Do you seek clarifications for all your questions where necessary? Do you correct your misunderstandings which were there, and do you reflect on your performances, that when the whole thing happened, did you check, yes, I'm satisfied with the information and the procedures that are doing really great. Now, how to ensure the ethical communication? Now, what confirms that yes, it's a proper communication? In that communication, doing no harm to any party, doing good for all the stakeholders, respecting people's privacy, their autonomy to make free choices, not to be manipulated. Ethical issues in choosing issues and obtaining consent. It has to be crystal clear. There is no hidden fact. Obligations to promote health effectively and efficiently for all the parties involved. You should ensure that the health is promoted effectively and efficiently. Justice inequality, equity and knowledge gaps. There should not be any knowledge gap when the information is being passed out. Equity and addressing barriers, any hidden barriers, miscommunication, clear it out. Digital gaps. You cannot just pass on a message and say patients that aapko maine WhatsApp pe bhej diya. Is he comfortable? Does he know how is it to be done? A PDF file is sent. So the digital gaps on on both the sides have to be understood, and they should be on equal platform, equity in strategic segmentation and targeting. So, groupism, segmentation should not be there. Equity on trust. Ensure that both parties have equal trust on each side whenever the information is being passed on. How do you ensure the ethical approaches of caring and connectedness? Ethical framework has been noted as a central to communication of approach. Have ethical, what does it mean? Ethical approach, which stresses on social relationships and interdependence, that develop a good bond between nurse and patient and doctor, doctor and the nurse and the other parties. When a trust is there, information becomes a free flowing process, a kinship. Now there is somebody who is affected or infected or debilitated. That is the reason one party, you have to be absolutely practical in delivering the information, but yes, there has to be a compassionate behavior in passing on, a sense of common purpose and tradition among members of the community. When it's a group information, any community which is being passed on, this framework prioritizes values such as, which are the values which have to be followed to connect both the parties with each other: generosity, compassion, peace, stability, solidarity, sympathy, and reciprocity. So this is the key to any healthcare communication success. Now, the next is communication benchmarking. When you say that this is the best communication which has happened, or it serves the purpose, communication stipulation for ethical communication, it is a truth which has been passed on. It's a complete information which has been passed on. It has been passed on with full sincerity, and it includes all the information which must have gone. Stipulation as to truth of health information, stipulation as to correctness and reliability of health information, stipulation as to comprehensibility, clarity, and completeness of information, and also to sincerity. What do you mean by sincerity? What was my intent and goal in passing this information? Has it been achieved? This is what is meant by when you say what is the benchmarking as such. Now, a couple of slides in next 2 minutes on what is in for me as a student or when in the industry. Medical communication. Now, where does it come into picture, and how does it deal with? Now, we saw the information which is being shared at the grassroots level, healthcare triangle, the patients, staff, and the healthcare providers, which is doctors, hospitals, etc. There are pharma companies, there are external consultants who are designing such communication which are being passed on. Now, medical communication is that. Medical communication is development and production of materials that deal specifically with medicine and healthcare. So, your leaflets, visual aids, the CME slides, whatever you could think of, the journal materials, the publications, papers. It is at its core, medical communication is all about raising awareness of the therapies, the disease area, medical device that could they transform, in many cases save people. Not in many cases, all cases, it has to save the life. Okay. Now, who is involved in this medical communication? Encompasses the development and delivery of program that facilitate scientific exchange among doctors, pharmacists, nurses, and any other stakeholder in this value chain. Within this space, including payers are your patients or the insurers, formulary decision makers, the government agencies, and the patient advocacy group, which the NGOs I was talking about. Now, what is in this medical communication, the ones who develop it are called as medical communicators. Medical communicators are those who write, edit, develop materials about medicines and health. They do this by gathering, organizing, interpreting, and presenting information in a manner appropriate for the target audience. Now, there are agencies, there are pharma companies, there are small startup companies which do this role. Professional medical communicators have communication expertise, awareness of ethical standards, and healthcare knowledge. Now, they are the expert in preparing these documents and data files. Last slide now. Now, what do they produce? Now, when we talk about medical communicators, commonest term we use is a medical writer. Now, in a developed world, we could call it as a medical communicator. A medical communicator collaborating with others or working independently include the following. What do they do? The journals, articles, and manuscript for medical and scientific publication, continuing medical education material, presentations, posters, banners, whatever it could be for HCPs, regulatory document for government agencies, patient education brochures, news articles, website content, and books for the general public, healthcare policy documents, grant proposals for research scientists and institutions, and sales training and marketing material for pharmaceutical, medical device, and other healthcare product. Doesn't limit everything, but I just wanted to capture what we see in day-to-day life. Now, what is my take-home message for today's presentation or a session? Health communication should adhere to principles of beneficence. These are the value systems: non-maleficence, respect for personal autonomy, and justice. All stakeholders hold equal responsibility: doctors, hospitals, patients, relatives, caregivers, NGOs, government agencies, and the companies. Follow the value system, and the correct framework has been globally designed or been followed locally or regionally. Unethical practices would impact lives, brands, and monetary business impact could be there. Just a small note: medical communicators either lucrative career options in the current eras or since last 10 years. Okay, with that, I end my session and I am happy to take questions.
Thank you so much, Dr. Sakharam. It was a wonderful session. We are open to questions now. So people having questions can put it up in the chat box.
You will read it out for me?
Yeah, I'll read them out for you.
Do you want me to stop sharing?
Yeah, you can. Yeah. So are there any questions from the participants?
Yeah, hi Aditi. I have a question for Dr. Garale.
Yeah, shoot.
Good evening, Dr. Garale.
Good evening.
Dr. Garale, I am Srinivas. I come from the agency background,
Yes.
medical communication.
Yes, please.
So I have a question. See, the ethics part, what just recently I have gone through, it's a very comprehensive one. But more or less it was related from the doctor patient per se. But the challenge what I face in my industry is that if we look at the main advertising industry, so if there is any issue, so these people, they reach out to the Advertising Standards Council of India. So what happens in the pharma? Do we reach out to the UC PMPPM, or is there any particular nodal agency wherein people go, or the pharma companies go and they put a claim and cross claim? How that is particularly handled when it comes to medical communication?
Now it's two-way. I think what probably we need to understand, because I also work on the same platform. For initially, I was a part of pharma industry.
Okay.
I mean, giving business to others. Now on the other side.
Right.
Now, when you are on the pharma company side, no, there are multiple resources involved. Like any healthcare communication which happens now, say you are developing any document or any sort of material.
Right.
So there are regulatory and legal teams sitting to approve. Without that, it doesn't go out.
Okay.
Nothing at all happens.
So it's in-house.
Yeah, so it's like they will either develop by their medical communication, medical information, or medical affairs team. Right. Even if it's their whole in-house resources, they are developing it. But if it is going out on the public platform, they will ensure that the information, because if I'm a doctor, I know what is justifiable on the medical front, and I will put it with references, everything with the data.
Right.
But still, I am not the last authority to shoot it. It will go to regulatory authority, regulatory affairs team. Regulatory affairs check all the claims made, whether they hold true or is there an issue, and then it will go to the legal team. Legal team would check the branding, the messaging, anywhere it is getting compromised, and they say, yes, this particular message is ready to shoot out on a written document or in the system. It is approved by everyone. So the responsibility is equally shared. Now, suppose even after all the checks, something goes wrong. That I have gone through this in my career. So
Okay.
if it goes wrong, it is not medical affairs, not regulatory. Legal takes it up and they fight the case. But there's no harm in this. This is a routine process. It does happen. Every big company goes through this.
Okay.
Now, say we are an agency now.
Right.
You and me. Suppose we take a work and we have, but we don't do on our own. We do work for someone else.
Right.
And we are being paid for that.
Okay.
Okay. So when we do such things, we are being covered by the sponsor.
Okay.
So we don't do, I am not doing independently some communication. I design it for someone, I hand it over to you.
So the liability directly shifts to the sponsor.
Exactly. We do 99% of the time it's with the sponsor. But suppose you put some information on the public forum, open domain.
Okay.
That, Srinivas has put something on the LinkedIn or on the Facebook, which is health related information.
Right.
Again, these are being scrutinized nowadays. So somebody puts up and, he files a case against you, then it's on individual form.
Okay.
So you have to be very careful that what information related to, community health you're putting out. General talks and all, it's absolutely fine. Because we are all wise enough that what we share on the public platforms. So this is how one has to deal.
Okay. Great. Thanks a lot, sir. Thanks a lot. You have cleared the complete.
You're welcome, Shri.
Yeah. Thank you, sir.
Any question? I'll be happy to take if there are any questions.
Well, good afternoon, Dr. Sakharam. This is Vishy here.
Hi, Vishy.
Firstly, thank you very much for touching the topic on ethics in communication, and thank you very much from the team. Okay, so I'm going to ask you a pretty tricky question, and I believe that you are the person who would be in the level to answer it. A lot of people, they ask me that is AI going to impact the role of medical writer? Okay, is AI going to take the role of the medical writer and medical communication, and predominantly from the clinical research side? So can you share some of your insights in this line, whatever you are thinking?
Okay, I think what the limited knowledge and my information with the industry connects and currently I deal with, probably I would say not in the recent future, for sure. You cannot justify whatever I have seen with the artificial intelligence and healthcare, with the digital health, IoT and everything. We are only dealing with predictive healthcare currently, but the grassroots delivery, I don't think so it's happening. I mean, same what's said about robotics, that, it will come, and, we have to always understand that we are still a developing country. I don't know when the tag of developing would go and we'll enter into a developed country, but it's still a speculation. But then AI completely displacing the existing process and saying that now AI would handle everything. It's not at all possible in near future. It could certainly take up a section of these activities and improvise and innovate, but it cannot replace the whole process as such in the near future. So job losses or reducing the career opportunities, I don't think so. But somebody who's into this at certain level can definitely enable themselves with AI, additional tools and certifications, and enhance their career and uplift it, because AI, it did not fall from the sky. We have developed it. So we have to ensure that how can we upgrade ourselves with the AI tools to enhance the procedures, speed them up, reduce timelines, and then ensure the ethical things and the timely deliverables. That's what is my take on it.
Well, thank you very much. In fact, I was just thinking to have one session on the AI role and the medical writer's role. So we'll debate on this. So thank you very much. And again, from the industry perspective, since you've been, as I really like the statement, 5 years back, you used to give the job and now you're providing that same service. There's something called ATCOM, that's the Attitude, Ethics and Communication among the medical students. Okay. So what is your stand? It is not mandatory in the curriculum, and do you think that that is the one aspect which has to be? I mean, it is implemented, but the grades are not mandatory. And do you feel that there is somehow the requirement of a compulsory subject of medical communication per se? Because today, even if when any kind of augmented AI, anything is coming up, the physician and the healthcare professionals are communicating quite a lot. And that is something which we are lacking in the medical education curriculum or even health education. So, what would be your say in this particular field?
As one of the stakeholders in the industry, seen both the sides, I would say yes, it has to be included, because then it is lacking for sure. Now I will take back you 21 years behind when I did my graduation, 22 years. Then we never were exposed to computers. I could never imagine that. We are the generation who have switched from transistor to black and white to color TV to smart TV to interactive televisions, and then no phone, a box phone at home to a big size mobile phone to a small phone, a pocket phone, and then everything in phone, including computer. So that kind of transition has happened. So when we switched to, why am I insisting that it should be there, is that not because I want somebody to come and take a business out of it, but yes, for sure, somebody who has an opportunity would take it. But then not having it is reducing the speed, and is also not letting things go faster or improvise and innovate. Now the policy making decision is not in your and my hand. And even if there is a policy, implementation, if it's happening or not, again is the part of who are the policy makers. So that is also not in our hand. So I to answer your question, I would say yes, it has to be there, because for me, even when I passed out and I entered into the industry, to operate a computer was the biggest task. I didn't know how to send emails, how to draft emails, then how to react on emails, what language you should use when you type words, not English as such, that hello, oh dear, thank you, hi. So we were never taught about this. So only experience made us kind of near perfect that how should you cope up. It shouldn't happen with EdCom, that it is there. No, I don't need it. When it affects or somebody mandates only, then I'll do it. Proactively, people should do it if decision making is with me. I mean, if I am a student. And secondly, colleges or the state governments where it has been mandated should ensure that it is included in grades and it is part of the system and curriculum.
Thank you very much, sir.
Thank you, Vishy.
Thank you.
So thank you so much, Dr. Sakharam, for patiently answering all the questions. I guess there are no more questions from participants, and we can go on to closing the session. It was a wonderful session, and we had a lot of information. So thanks a lot. And I have one question from my side before we close. So do you find the need of having ethics in social media communication from provider, or guidelines of communication coming from clinicians, marketing, or pharma communication?
Now, I don't think so there are any written or black and white rules and regulations. I but feel there is a need. They are not there, but they should be there for sure. But I don't know that, how and when government will take it up. Like recently we had 6 or 7 months back, we would talk about non-healthcare communication, that Twitter getting grilled, Facebook getting grilled. But what is getting posted or shared on mainstream social media platforms and its impact on a person or a community or a group or a society as such is not being bothered by the policymakers or decision makers. But I completely agree with you that there is a need that it should be in a controlled manner.
Yes, I agree to that point, and definitely from our side, we'll be making sure that all our communications are ethical. So thank you. And And thanks to all the participants for taking out time on a weekday, and have a happy weekend, happy learning. And thank you so much, Dr.
Thank you,
Sakharam, again.
Thank you, Ishit. Thank you, Aditi, and the whole team. It was a pleasure interacting with you and the whole MedEduPro team. I appreciate all your efforts. You're doing a great job. Keep it up.
Thank you very much, sir.
Thanks a lot. Bye-bye.
Bye.
All the participants, whoever is interested to check out our website, you can visit us on www.mededupro.com. I'm just sharing the website to you. You can understand what we do. So it's www.onlinemedicalwriting.com. And you can also check us out on LinkedIn. I know most of you have found us through the postings done on LinkedIn. So we are always active and always ready to take in your questions. Also, we would like to know from your end, what are the other webinars that you are requesting? You can always reach me out on this, aditi@mededupro.com, and let us know what is your requirement of webinar topic and what are the discussions you would like in future. Thanks a lot.